Hello, it's Debbie Fox from the National Network to End Domestic Violence. I am the Senior Housing Policy and Practice Specialist here at NNADV. We are here today. We're going to have a presentation, a webinar on the HUD NOFA and about the Continuum of Care program competition and what domestic violence and sexual violence programs need to know about the upcoming HUD NOFA application process. So we have a few presenters on the line with me today that are part of the Domestic Violence Housing Technical Assistance Consortium. We have Peggy Beavis, who's the Director of Safe Housing Practices at the National Resource Center on Domestic Violence. Peg Lascolo, the Director of the National Alliance for Safe Housing. Brittany Manzo, the Policy Advisor at the U.S. Interagency Council on Homelessness. And as we get further into the webinar, they'll introduce themselves and talk about their organizations a little bit more. So to get started, just so everyone has a little bit of background history of the work that we're doing together in the Housing Consortium. A lot of people are familiar that the Consortium initiative began in 2015, and it's a pretty unique and innovative project with support from multiple federal agencies, including the Office on Violence Against Women, the Office of Victims of Crime, Family Violence Prevention Services, Health and Human Services Office, and the Housing and Urban Development. So there's a lot of different partners that have come forward to recognize and address the need around the intersection of domestic violence and homelessness. So as I mentioned earlier, there's a few organizations that are part of this webinar, including USICH, who's also a partner in the consortium. And depending on our background and the work that we're doing, there's different leads for various topics that the different organizations focus on, providing technical assistance and training for DV providers across the country. I do want to do a quick shout out for the work that we're doing around a needs assessment. We sent out a link through a lot of listservs, through the HUD exchange, email to Continuum of Care. So we also have been putting the word out through social media avenues about our needs assessment that is going to shape housing policy around domestic violence and the intersection of homelessness. So we ask that you please fill out that needs assessment. It takes about 10 to 15 minutes out of your day, and it really is very important and will have an impact on the work that we do here at the federal level, and it will help us influence decisions and projects and planning as we move forward. So please fill that out. We want a broad representation from coalitions, DV victim service providers, and from Continuum of Cares and homeless agencies across the country. So please spread the word. I also want to bring to your attention that we have NOFA products that are also going along with this webinar. We had a pre-NOFA webinar that we did about a month ago that you can find on the Safe Housing Partnerships website, which I'll show you the link to that webpage in the next slide. We have some different documents. We have a coordinated entry document. We have a HUD NOFA scenarios document that will be coming out shortly. So we encourage you to visit the Safe Housing Partnerships website to learn more about the NOFA process. And there's a special part of the webinar, or of the website that has more information about the NOFA, and will give you further guidance. So here is the overview of the Safe Housing Partnerships website, and you can see it's safehousingpartnerships.org. So there's a lot of different information there, and you can go there to find research. You can request technical assistance, and the Housing Consortium will respond to you there. There's a lot of great information and in-depth resources that you can check out. We encourage you to visit the website. So without further ado, I'm going to go ahead and pass it on to the first presenter of the day, Britt Manzo, who's a policy advisor at the U.S. Interagency Council on Homelessness. So Britt, if you could please take it away and introduce yourself, that would be great. Thanks.
Great. Thanks, Debbie. Debbie, did you want to walk through the objectives of the webinar since this is your space?
That's good. Thank you so much. I was looking at my paper copy. Yeah, so real quick, the objectives of today's webinar is we really want you to come away and have an increased understanding of the HUD NOFA process and and be aware of what the HUD NOFA, what it entails this coming year for this process. We want people to understand the different system performance measures, how applications are scored and what's taken into consideration. We also want people to engage and coordinate with their continuums of care. It's really important for us to have the bigger picture of working with COCs and our partners in the homeless system to increase access for domestic violence survivors for housing resources with coordinated entry. We're going to highlight different opportunities and potential changes in the NOFA and how that could impact DV sexual assault providers in the process. And then we are excited to talk about the new joint component project model that is a hybrid model that's a combo of transitional housing and rapid rehousing, permanent housing, and how you could consider working that into your application and making that a part of your NOFA process. So I think, yes, without further ado, it's your turn, Britt. Thank you.
Great. Thanks, Debbie. Good afternoon, everyone, and good morning to those on the West Coast. I'm here to offer an overview of the Continuum of Care program and the 2017 program competition. My name is Britt Manzo. I'm the policy advisor here at the U.S. Interagency Council on Homelessness. I'll start with an overview of our agency, then move on to the COC program and the NOFA, and wrap up with a few ways we recommend DV service providers and homeless service providers might use this program competition and other levers to strengthen collaboration locally. For those who may not be familiar, USICH is an independent federal agency charged with coordinating the federal and national response to homelessness and partnering with all levels of government and the private sector to reduce and end homelessness nationwide. You'll see our 19 federal partners listed on this slide on the right. We work with them to drive this work forward. Partners from each of these agencies have significant roles to play in our work, and we strive to ensure that they are creating opportunities and reducing roadblocks to ending homelessness. So before we get into the opportunities for partnership between local homeless service programs and domestic violence service providers, we wanted to do a bit of the level setting work to make sure we have a shared understanding of the COC program. The Continuum of Care program, which is housed in HUD's Office of Community Planning and Development, is charged with promoting community-wide commitment to the goal of ending homelessness, as well as providing funding for quickly rehousing individuals and families experiencing homelessness. They're also charged with providing the funding for those efforts, as well as promoting access to and effective utilization of mainstream programs by homeless individuals and families. And I want to pause here for a second. When those in the homeless service system refer to mainstream programs, we're referring to those that aren't specifically targeted to individuals experiencing homelessness, but are rather widely available in the community. Domestic violence services would apply there in some ways because they're not specifically targeted. So excuse us for speaking a bit of a one-lane language, but we want to make sure that others understand what we're talking about when we refer to mainstream programs. So the Continuum of Care program is also targeted at promoting that access and effective utilization of mainstream programs and optimizing self-sufficiency. The COC program is structured as having COCs covering every community across the country to serve as local governance structures for homeless service programs. Their key functions, of course, include applying for and dispersing funding for the homeless service programs, but also monitoring and evaluating grantees' performance and establishing written standards for those programs that guide the way they work as a community, as well as managing data. These functions make COCs the hub for collaboration across housing and service providers. Given their role at the local level and their mandate as federal partners, we often look to leveraging the COC program as the home for opportunities to strengthen collaboration across systems and programs that serve individuals experiencing homelessness in communities across the country. Today we're here to discuss the role of domestic violence service providers in connecting survivors to housing and mainstream supports, and how partnerships with COCs might be leveraged. Federal partners have done quite a bit of work to lift up opportunities for collaboration. It's important to start off by noting that HUD's definition of homelessness does include individuals and families who are fleeing or attempting to flee domestic violence, dating violence, sexual assault, stalking, or other dangerous or life-threatening conditions that relate to violence against the individual or a family member. And so we should always be thinking about collaboration across these systems, given the significant overlap in those we are seeking to serve. In thinking through opportunities for your programs to more seamlessly connect or to strengthen partnerships with homeless service systems, we've outlined a few opportunities for collaboration here. While these are not all easy points of entry for your partnership, we've seen many communities from Buffalo to Houston and Connecticut to Los Angeles demonstrate that these are effective strategies for building partnerships that result in better access to services and housing for the individuals and families we're looking to serve. So some of those ideas for collaboration are two-way board membership, having representatives of COCs sit on domestic violence service program boards and vice versa, having DV representatives on COC boards. Offering cross-training to understand each other's systems and the best practices you employ that might inform the other system. For example, trauma-informed care is an area where both systems might be able to learn new strategies from each other. Point-in-time counts are another kind of more easy point of entry for collaboration, finding ways to ensure that survivors of domestic violence are captured in a community's annual point-in-time count. And then coordinated entry and using de-identified active lists to make sure that survivors are captured and getting access to housing through the community's coordinated entry system. We see some really innovative ways that that's happening effectively in Connecticut, and Houston's trying out some interesting things too. I believe Buffalo has some great work underway. So this is all possible, though it may seem difficult or challenging at times. Service referrals are another way to make sure that your programs are talking to each other and connecting your recipients or clients to the services they need. And last, but certainly not least, COC funding for domestic violence and sexual assault programs. So the remainder of today's program, today's webinar will focus on COC funding for DV housing programs. HUD's Notice of Funding Availability for the COC program competition was released earlier this month and offers the parameters and guidelines for COC funding. Your partners at your local COC are surely in the middle of their process to build their 2017 application. So while this is the vehicle for funding COCs and their grantees, the NOFA is also the vehicle through which HUD communicates its priorities for funding and serves as the mechanism for COCs to rank programs for funding. The NOFA is leveraged to encourage best practices, partnership, and improvements in system performance. COCs, when we look at understanding, ranking, and differentiating scoring, we just want to keep in mind that COCs are scored based on their ability to demonstrate alignment with HUD's policy priorities. All of this scoring and ranking is based on performance and is designed to ensure that communities' gaps in services and housing for individuals and families experiencing homelessness are being filled. So this year's NOFA includes access to about $2 billion in funding to the 400 COCs that cover the country. Some of those COCs, just for context and awareness, some of them can cover an entire state. Some of them are just one city. Each COC is structured differently. So some other details are that the application deadline is September 28th. So we're really encouraging you, if you're not already in discussions with your local COC, to start those conversations now to explore opportunities. So in this year's NOFA, HUD has outlined 4 policy priorities. The first is ending homelessness for all persons. The second, creating a systemic response to homelessness. The third, strategically allocating and using resources. And the fourth, using a housing-first approach. So if you've read through this year's NOFA, the application announcement, you'll see that there are points tied to each of these different pieces, as well as others, to encourage communities to be applying these practices and tailoring their projects accordingly. So having more programs using a housing-first approach, demonstrating that the community's response to homelessness is not having 4 shelters that are disconnected and not talking to each other, but rather they're demonstrating that they have a systemic response to homelessness in their community. And strategically allocating and using resources is, of course, the way that the COC is managing the funds that they're dispersing to different grantees. So as we go through the application, there are 5 eligible project types. Permanent housing, which includes rapid rehousing, as well as permanent supportive housing. Transitional housing. The joint transitional housing and rapid rehousing component project, which I believe my colleagues will talk more about later. supportive services only, which this year is only eligible for coordinated entry, implementing coordinated entry, and the last is HMIS implementation. So looking through the NOFA, we wanted to lift up ways for DV providers to engage and strengthen their community's application. Where can you plug into your COC to help them expand the options available at the local level and strengthen the application? We really recommend that you look at these as opportunities to support the COC and opportunities, kind of entry points for discussions with your COC. So we'll walk through some of these quickly, but my colleagues Peggy and Christy will dive into a few of them a little bit more. The first opportunity is that in this year's NOFA, there is a specific call-out point that COCs are awarded points for addressing the needs of victims of domestic violence. That language, for those of you who are way deep in the NOFA already or have read through it, that language is on page 43. And it really outlines that HUD is expecting or hoping that communities will really create opportunities for DV service programs to be voices in COC management. You'll see that part of the points that are allotted here are to credit a COC when victim service providers are voting members of the COC, or when regular training is provided to COC providers. So digging in there and offering to partner with your COC to build out the mechanisms needed to make this a reality would be a great entry point for those of you that maybe haven't yet partnered closely with the COC. Other opportunities are to connect with coordinated entry. COCs will be awarded points for seeing DV service providers and other programs connected to coordinated entry. Other opportunities are implementing Housing First, implementing a joint component program, exploring dedicated plus opportunities, and expansion projects. So those last three are opportunities for domestic violence housing and service providers, to get funded from HUD for their housing programs. So one way is through the joint component program, which I think Peg will get into a little bit later. The other is exploring opportunities for dedicated plus housing, which is permanent supportive housing for individuals who may not be chronically homeless but do need those services that are attached to permanent supportive housing. And then the last opportunity that we want to highlight here are expansion projects for, I'm sorry, there's a mistake on the slide. What we actually mean here are expansion projects for programs that are not already receiving COC funding. So that's an opportunity to expand services or units or beds. Even though your program may not be funded through the COC already, there's an opportunity in this NOFA, I believe in every year, for you to get funding to expand your project. So these are just some new opportunities in addition to rapid rehousing and other ways that domestic violence programs may already be funded. So before I turn it over, I want to highlight just a few quick opportunities to look for more resources. You'll see, my colleagues have already talked about safehousingpartnerships.org, but that's where you can get direct technical assistance on some of these topics. There's also the National Alliance to End Homelessness. We'll be putting out some resources for around this NOFA, as well as USICH will be holding a webinar on Wednesday, August 2nd at 2 p.m. on the NOFA more broadly. So stay tuned for that and other opportunities to get more information. But I'm going to turn it back over to Debbie, I think.
Debbie? Okay. I'm going to go ahead and take, I don't know if you need to introduce.
Go ahead, Christy. Yes, please.
Okay. I'm just jumping right in. So good afternoon, everybody. I'm Peggy Beavis, and I'm the Director for Safe Housing Practices and Initiatives, which is part of the National Resource Center on Domestic Violence. And I know many of you are really familiar or have been familiar with the great work that NRCDV has done. I recently joined them back in March. It's been tremendous to be a part of the consortium and to really have an opportunity to work on this critical intersection of domestic violence, sexual assault, homelessness, and housing. So next, we really wanted to take the great information, the overview that Brittany provided, and do a deeper dive into the NOFA. I don't know, for some of you, I can feel it already. Your eyes are starting to glaze over. But the NOFA is 60-plus pages in length, and there's a lot of great information in it. But again, just thinking about having the time to go into that much detail seems pretty tedious and quite burdensome. So we wanted to make it easy for you and highlight a few things today. So just to reiterate some of the things that Brittany has already said, there's one thing that I probably will repeat several times today, but I want us all to be on the same page. So first things first, and remember this. The COC applications will be assessed on a 200-point scale. So all points matter. Keep that in mind, right? As Brittany talked about, the COC application is really two parts. There's a COC overall application that gets submitted on what the community is doing at large. And then there's also project-level applications from the different organizations in the COC that comprise the total application. So this information is going to be hopefully helping at a program level you connect into what needs to happen at a system level, right? So also we want to highlight the opportunities around where and how DV projects can contribute to a strong COC application, and also how they can build up their own project-level submission as well. So let's get started. And as you know, we've been talking about coordinated entry for a long time now. So it's not really anything new. There continues to be a strong emphasis on coordinating and establishing a coordinated entry process for the COC and across the community, which includes how our COCs and DV and SA programs coordinating with each other to prioritize survivor safe housing options. So while we've been talking about coordinated entry for a while, HUD has released the coordinated entry notice around some supporting guidance that each COC is expected to establish or update its coordinated entry process and be in compliance with the interim rules by January 23rd of 2018. So needless to say, this year's NOFA is going to put a big emphasis on the COC coordination and engagement, not only with the member programs of the COC, but how are the COC working in coordination across other systems in the community and with other funding sources to help bolster the services that they're providing to homeless individuals and families. So again, up to 43 points can be awarded for COC coordination and engagement. And if you're thinking out of 20 or 200 points, this is a big chunk. It's 21% of the total application or total points that can be awarded here. So again, every point matters, right? Okay. Oh, here we go. So I wanted to do a little bit deeper dive into what does coordinating with DV programs look like. So COCs need to have an inclusive structure and participation in place. They need to clearly demonstrate this participation among a broad array of stakeholders. It needs to be a transparent process as well. And it needs to, again, at a minimum, victim service providers, how are COCs coordinating and having an inclusive structure and participation from victim service organizations. It's not enough to just be able to simply check a box on the application to say that DV programs come to an annual meeting. COCs must demonstrate, again, that this is a transparent manner and clearly show how DV stakeholders are participating at multiple levels throughout the COC. So it's not just attending an annual meeting, it's being a voting member of the COC, it's being in leadership, it's participating in working groups, it's helping to make funding decisions, policy decisions, et cetera. So it's a wide array of how DV programs need to be included in the COC structure. And again, coordination with federal, state, local, private, and other organizations. Based on what we've already talked about, we know working across systems to serve domestic violence is really important, and HUD's really emphasizing this in this year's NOFA as well. And, you know, it needs to happen at multiple levels. And it's one of the things like the Consortium is doing to help model what that looks like. So we're really excited that it's also being emphasized in this year's NOFA as well. And to continue on with what Brittany said around addressing the needs of victims of domestic violence, COCs must demonstrate how they ensure that persons fleeing domestic violence have access to housing and services that prioritize their safety, and then also accommodate their unique circumstances. So this means it's across funding streams and, again, across system partners. How does the COC program align with the Emergency Shelter Grant Program? How are HUD-funded programs aligning with the Department of Justice programs with OVW and also with the Department of Health and Human Services? It needs to be this interconnection and intersectionality to be sure we are maximizing housing and services for victims fleeing domestic violence. Further, the COC must identify efforts to increase safe housing options. So it's just not enough to have housing options in place or to increase access to this housing, but how do we ensure that it's safe housing and it's access to safe housing options along with the services that are needed? So that includes programs receiving COC funding. They need to adopt and implement a victim service practice. They need to maximize client choice. And how are they maintaining safety and confidentiality of program participants? So they've got to be able to demonstrate this in this year's NOFA in order to maximize the point. And what we know that this is best practice not only for survivors of DV and sexual assault, but it's also best practice for the homeless population in general. So again, just to reiterate, maximum points will be awarded in this year's NOFA to COCs that demonstrate victim service providers are actively part of the COC and that they're voting members of the COC. Regular training is being provided to COC providers and also to the points of access where coordinated entry is happening. So the intake and triage folks, they're getting regular training as well. So they know what best practices are around serving domestic violence. And it's not only about just the domestic violence or best practices, but they also understand what trauma-informed care is. The COC is also using statistics and other available data about domestic violence. And since victim service providers do not enter data, personally identifying data, into the HMIS system, it's how do we use the aggregate data from comparable databases as appropriate to really be able to bolster the progress and to demonstrate the successes that we're having in helping to provide safe housing options for survivors fleeing domestic violence. And of course, safety planning protocols are a must in the coordinated entry assessment. So again, there's a lot going on, but maximum points are awarded to COCs that are able to demonstrate this. And as we said before, every point matters. And one quick resource I do want to point out, if you haven't had a chance to look at it, but there is a coordinated entry self-assessment guide that's located on the HUD Exchange. And it really does a great job of outlining what the HUD requirements are, what they are recommending as a good practice, but not necessarily required. And they also offer up emerging practices as optional, and emerging practices from communities, some of the communities that Brittany referenced already, and realizing that some of these practices may or may not be applicable to all communities, but they're certainly worth exploring to see if it's something you can lift up in your own community. So I would, if you need that link, I'm happy to provide that in just a moment after I finish going through some of this information. So I'll make a note of that to put that in the chat box as well. Okay, so just quickly, looking at these topics and other areas where DV programs have an opportunity to positively impact the scoring for COCs, we could certainly spend a webinar on each one of these topics, but I kind of just wanted to give you a high-level update on each one of them. So if we're looking at Housing First, up to 8 points can be awarded to COCs that demonstrate at least 75% of all their housing project applications in this year's NOFA are using Housing First approach. And just again, quickly, Housing First. It means survivors are being prioritized for housing based on their vulnerability and need. There are no service participation requirements or preconditions placed on folks entering the housing program. And survivors are not screened out due to fleeing domestic violence, having no income, or if there are any drug and alcohol-related issues that they are also experiencing. That Housing First means it's low barrier. So when we talk about rapid rehousing, up to 8 points can be awarded to COCs that demonstrate there has been an increase in rapid rehousing over what was reported in this year's housing inventory count data that was submitted to HUD along with the point-in-time count. And I know there's been some challenges around rapid rehousing for DV survivors. And what does rapid rehousing for DV survivors look like, especially when sometimes we feel like there's been such an emphasis on 3 months of less of funding assistance or regular rehousing. So I think it's important for us to be able to lift up programs that are doing DV rapid rehousing really well as models of practice and to show where those successes are, so hopefully we can build more opportunities to be doing rapid rehousing for survivors fleeing DV. The other thing I would add to mainstream benefits and other assistance, because I think Brittany did a really great job kind of covering that and defining it, up to 2 points to COCs can be awarded for COCs that demonstrate that their program-funded projects are supplementing the program funds with other resources. So it's needs for services, resources, and benefits outside that immediate scope of the housing and homeless services. Education, healthcare, childcare, TANF, Medicaid, job training, just to name a few. And even though, again, y'all are saying, well, it's only 2 points. Y'all know I'm going back to my catchphrase. Every point matters, and how are we demonstrating this effectively? So a couple of quick notes before we kind of move on that are new for this year's NOFA. So compliance with the VAWA rule. HUD did publish its VAWA final rule back in November of 2016. So this year's NOFA will really be the first grants awarded to programs where they're required to comply with the VAWA rule. And to enable full compliance with this rule, each COC must establish an emergency transfer plan and make related updates to standards for administering the COC program assistance. And the task must be completed by the time the local HUD field office issues that first FY17 grant agreement under the NOFA award. So if you have any questions, comments, or need additional information around what the VAWA rule looks like, Collaborative Solutions, who's also a partner with our consortium, is working diligently with HUD around TA training and implementation of this. But you can also submit questions or TA requests to the Safe Housing Partnership website as well, and we are happy to help build those questions and provide any additional information or pass along comments that you may have as well. So just to give another plug out for the Safe Housing Partnership website. The other thing under this NOFA, it does is clarify definition of homelessness as it relates to human trafficking. So again, HUD is clarifying that persons who are fleeing or attempting to flee human trafficking may qualify as homeless under Category 4 of the homeless definition. And then similarly under DV, there has been some question around does attempting to flee also qualify as homeless? So HUD is saying yes, that persons meeting the criteria of, again, Category 4 of the definition of homeless, if they're fleeing or attempted to flee, that they qualify as homeless. And as a quick review, if you're wondering about the categories of homelessness, Category 1 under the HUD definition of homelessness means literal homelessness. 2 is imminent risk of homelessness. Category 3 is homeless under other statutes. And Category 4 is the fleeing or attempted to flee domestic violence. So again, I'm happy to provide a link so you can have that specific language under each of those categories so you'll know if you're having any questions being raised by the COCs that now DV, not just now, but DV is fleeing or attempting to flee DV, that survivors can be considered homeless under this definition. As Brittany said, when we're looking at how projects can be awarded funding under the COC application, there's 2 ways. The first is through reallocation, and the second is through the permanent housing bonus. So let's talk a little more in detail about both, and let's start with the reallocation. So for those who may not be as familiar with the reallocation, it is a process where the COC shifts funds in whole or part from an existing project to create one or more new projects without decreasing their annual renewal demands, which is the ARD. And in HUD speak, annual renewal demand is just simply the sum of all of the annual renewal amounts of all the projects eligible within the COC. So it's going to be the maximum award amount coming in. New projects created through allocation, of course, need to meet requirements outlined in the NOFA, and they're also going to be project eligibility and project quality thresholds, minimum standards that they're going to have to meet. And we're going to talk about that in just a minute. So for instance, with reallocation, let's say you were a doing domestic violence transitional housing, and you wanted to, or interested in maybe looking at the joint component model, which is a hybrid model of transitional housing to permanent housing, which would include rapid rehousing. This could be a way that you could come in under reallocation and change from just only doing domestic violence transitional housing to also including a permanent housing component of the rapid rehousing under your umbrella. And again, Peg is going to get into that a little bit more, but I wanted to kind of throw one quick example of how reallocation could work. So reallocation, there's several ways or new projects under reallocation that are considered. Britt talked about this already, about the dedicated plus or the permanent supportive housing projects that are serving chronically homeless. There's the new joint transitional and permanent housing rapid rehousing component project, which we also refer to as the joint component model. There's dedicated HMIS projects, support services only for projects that are focusing on coordinated entry, and then rapid rehousing. So under the rapid rehousing projects, if they are serving homeless individuals or families and meet the following criteria, they could come in as a new project under reallocation. So are they serving clients or survivors who are residing in a place not meant for human habitation? Excuse me. And that simply means is someone living out of their car? Is it an abandoned building? Is a family living in a storage unit? Are they outside? Are they in a tent? Are they living on someone's porch? So that, that's just a few examples of what not meant for human habitation means. If rapid rehousing who serve clients that are residing in emergency shelter for persons meeting the criteria of the Category 4 definition of homeless, which again includes survivors fleeing or attempting to flee, residing in transitional housing project that was eliminated in the previous FY COC program competition, and then also for clients residing in transitional housing under the new joint component model, and then receiving services from a VA funded. So the areas that are underlined kind of really speak a little more to perhaps what some of the DV programs are already doing: emergency shelter, serving criteria or Category 4, attempting to flee or attempting to flee, or residing in transitional housing if you're interested in the joint component model. So now on to the permanent housing bonus. And this is the other option for how new projects can receive funding in this year's notice. So the permanent housing bonus, for folks who may not be as familiar, it's COCs may create new projects through this option based on a percentage of what the maximum award amount that the COC receives. So for this year's NOFA, a COC can apply for up to 6% of its maximum award amount, and they may also apply for more than one permanent housing bonus project. So typically in years past, that percentage has been a little lower. So for instance, if the maximum award amount is $2.5 million, and I know that's a little low because obviously we have a lot of COCs that receive a lot more funding than that, then 6% of that $2.5 million would be $150,000. So in years past, it may be where a COC would only submit one project under the permanent housing bonus option. This year, they have the option of submitting more than one. So it can be a way of expanding DV-specific housing options through the permanent housing bonus. Just a few notes: new projects created through the permanent housing bonus, again, have to meet certain project eligibility and threshold requirements. And also the COC itself has to score a minimum threshold of points to be able to qualify for this bonus as well. So we've talked a little bit already about project eligibility and threshold requirements, and what do we mean? So I'm so glad y'all have asked that question because we're about to dive a little deeper into it. So basically, HUD's going to review the project applications to determine if they meet project quality threshold requirements with clear and convincing evidence. So housing and services must be appropriate to the needs of the program participants and to the community. And then the determination that this project meets quality threshold is going to be based on a couple of things. One, for renewal, unless a project has had some sort of finding, maybe from a monitoring visit, not drawing down enough funds on a regular basis, etc., it's going to be assumed that they've already met the project quality threshold because they've already got the funding. So again, unless there's a funding against the project, renewal projects, it's going to be assumed that they meet this minimum threshold. For any of the new projects, there is a certain set of criteria that they're going to have to meet in order for their project to be considered for funding. And some of that criteria includes whether the type of housing, the number and configuration of units fit the needs of the program participants. So for example, 2 or more bedrooms for families. Does the availability of the housing and the configuration meet the needs of the program participants? Whether the type of supportive services offered to the program participants will help ensure successful retention and maintenance of permanent housing. Whether there's a specific plan for ensuring that program participants will be individually assisted to obtain the benefits of mainstream resources, and whether they're going to be applicable to what the program participants' needs are. And additionally, for the joint component model for this new transitional housing, rapid rehousing, hybrid model, they're going to have to adhere to a housing first model in order to be considered for funding. So if it is a new project proposing to do permanent housing, whether that's permanent supportive housing or rapid rehousing, they're going to have to make 3 of 4 points available, or score 3 out of the 4 points available. For the new joint component model, they need to score 3 out of the 5 points available. And again, Peggy will get into this a little bit more in a minute. So now, as we're starting to wind down on the information I'm presenting, I wanted to touch quickly on project ranking, review, and capacity. And this in of itself, I know, is enough to make your head spin, but we did want to point out that under the review of project applications, whether it's new or renewal, project ranking, review, and determination of capacity must be done in an objective, consistent, and transparent way. So that first bullet point, when it talks about demonstrate existence of a coordinated, inclusive, and outcome-oriented community process for the solicitation, objective review, ranking, and selection of project applications, ... It simply means there has got to, COCs must have an objective, consistent, and transparent manner in which projects are reviewed, ranked, and determination of capacity is made. And that must be posted in the public place for everyone to know how that process happens. So project about capacity, just a quick note on that, is the process by which renewal projects are reviewed for performance and compliance with the COC program interim rule. And project applications will be evaluated around 1, objective criteria and past performance, and 2, severity of needs and performance. And we're going to do just a quick dive a little deeper into each of those areas. So when you're talking about objective criteria and past performance, it really is the extent to which the COC and also for the project applications themselves demonstrate the use of established objective criteria, and where available, past performance data is used to review project applications. So maximum points will be awarded for written documentation that demonstrates the process the COC used to review and rank projects. Did they use objective criteria around cost effectiveness, performance data, type of population served, or type of housing proposed? Did they include at least one factor related to achieving positive housing outcomes? And most importantly, did they include a specific method for how they evaluate projects submitted by DV and SA providers that utilize data that was generated from a comparable database and consider the unique circumstances of the DV providers and also for the survivors and population that they serve? So if COCs are able to do this, there's up to 18 points that are able to be awarded. And again, when we go back to what I say, all points matter. But it really is important for them to be able not only to say, oh yes, we are evaluating our DV programs and project applications objectively. They have got to have a written specific method for how that happens. So when we're talking about severity of needs and performance, it's the extent to which COCs are considering the vulnerability that DV survivors are impacted by and are experienced. You know, often a lot of the assessment tools in place are not assessing for the high degree of vulnerability that survivors face. And so thus our DV survivors are not being prioritized first for safe housing options. So in order to address that, HUD really is asking them to be able to illustrate how across the different subpopulations, particularly for survivors fleeing or attempting to flee, how is their vulnerability, how are they addressing severity of need and also performance. So the other piece around needs and vulnerabilities include, you know, making sure that it's low barrier and easy to access. So clients or survivors who have low or no income, clients who may be having a current or past substance abuse. And then also when we're talking about a history of victimization, which would include our survivors of DV, sexual assault, and childhood abuse. Up to 4 points will be awarded for the extent to which COCs consider the severity of needs and vulnerabilities, and maximum points will be awarded to COCs that describe the specific needs and vulnerabilities and how the COC takes this into account when it's reviewing, ranking, and making its selection process. So I know this is a ton of information thrown out to y'all, but again, because that NOFA is 60-something pages in length, it's not always an easy read. We really wanted to be able to pull out where you can maximize points, where there's opportunity really to strengthen that collaboration engagement between the COC and the DV program, and then where there's opportunity to apply, whether that's through renewal or through reallocation or through the bonus housing project. So Peg is now going to talk a little bit more about the joint component model, which we're really excited about the opportunity for this. So the last thing I will say to keep in mind, and again, y'all know it's going to be my go-to, all points matter. So Peg, please take us away.
Thanks, Christy. So I get the feeling we're going to be quizzed on this at the end, like what's the major question? All points matter?
Thank you.
Exactly. So I'm going to go through a little bit in more detail around the joint component model, just to give you all a little background on me. I run the National Alliance for Safe Housing. We are a project of DASH, which is the District Alliance for Safe Housing in DC, and our focus as part of the consortium has really been on providing support around partnerships between domestic violence and homeless and housing programs, in order to ensure that survivors have access to housing across the board. So we, as Christy said, are very excited about the joint component model because we think that this really provides a new opportunity for domestic violence and sexual assault programs to partner with COCs to fill a gap that might be happening in their communities around ensuring that there's housing available for survivors and really enabling them to move into permanent housing and really connect with other housing resources in their communities. So this is a new program that was offered just this year in the NOFA. It's something that was being considered by HUD for about the last year and was something that was informed through the work of our consortium with HUD to offer programming that would be more survivor-friendly, if you will. The joint component model is targeted to more than just survivors of domestic violence. It's really focused on how to provide that kind of bridge housing to people with the highest needs. So obviously for survivors of domestic violence, but also for youth and just more generally to unsheltered individuals and families. And the program is really designed to better serve homeless individuals and families, including those that are fleeing or attempting to flee domestic violence. And I know we've touched on that a little bit earlier, but it's something that is worth emphasizing, that we are hoping that communities can design programs that will provide housing options for those who are not just literally homeless, but who are also meeting that sort of Category 4 definition of homelessness in attempting to flee domestic violence. It's also designed for people who need additional help accessing crisis housing or transitional housing before they're able to move into permanent housing. And so, for instance, in the case of survivors who are in the process of attempting to establish safety and who may not be in a position to move into permanent housing right away, but who need to be in a safe, confidential program, this joint component model could be a really good opportunity, as well as for people who just have significant barriers to permanent housing. The joint component model is a possibility, and this is something we really wanted to stress from the outset, for domestic violence transitional housing programs that may have lost their funding in the last couple of years, as HUD has put more of an emphasis on other types of housing programs. It is something that would be possible if these programs are creating a new project that combines transitional housing along with permanent housing or rapid rehousing. So again, the idea of the joint component model is that it provides a bridge between temporary crisis housing, and that phrase is being used sort of interchangeably. So crisis housing, transitional housing, something that's designed to be temporary, and that there's that bridge to then helping individuals and families move into permanent or rapid rehousing. But that both housing types have to be offered through this project, allowing participants then to choose the type of housing that's right for them. So in other words, if there are participants who come into this project who are ready to move into permanent housing or rapid rehousing, they should have that option available to them. If they would prefer to be in a temporary transitional housing kind of housing, that option should also be available to them. So the project should really be able to speak to how they will assist participants to move into permanent housing of their choosing at a time that's ready for them. And when they're ready to move into the permanent housing of the program with support from the housing provider. The expectation of the joint component model is that it really be client-centered, trauma-informed programming. My colleagues, Britt and Christy, really did an exceptional job of sort of laying out what it is that the NOFA has outlined in terms of the expectations of successful applicants. So you'll see some of that repeated here, but very clearly a lot of the best practices that are expected are, safety and goal planning for participants who are in the project, the ability to quickly facilitate the move into permanent housing when participants are ready for that, using a housing-first approach, offering low barrier access to housing, using a landlord engagement strategy so that programs have the ability to easily move participants into permanent housing if that's the model that's being proposed. Having wraparound services along with the housing and really being able to connect participants to community services, particularly services that will support participants with any kinds of trauma care needs or self-sufficiency goals that they may have, and also help participants with resources to move into permanent housing. So the eligible costs for the joint component model, and this was something that we were also really excited about because it really provides a broad array of the kinds of costs that are eligible in these proposals. It will cover capital costs or leasing or operating costs for transitional housing if that's what's needed to provide facilities that offer transitional housing. It'll support funding for short and medium-term tenant-based rental assistance for rapid rehousing. So if the proposal is to support participants to move into scattered site housing in the community, then this model can provide the funding for tenant-based rental assistance to do that. It also provides funding support for supportive services, for participation in HMIS, and comparable databases, of course, in the cases where programs are proposing to work with survivors, as well as to support project administrative costs. So it really supports a broad range of different activities under the scope of the program. And the funds can be derived from either reallocation or through the permanent housing bonus, which Christy just went through in detail. Proposed projects will be evaluated using the same criteria regardless, so whether you were to decide to apply either through a reallocation or through the permanent housing bonus, the same criteria will be used to evaluate and assign points to the proposal. And funding can be up to a year or 3 years if capital funding is requested. And proposals, of course, will be ranked and prioritized the way that all proposals in the COC, in this NOFA competition are. So the amount of housing that should be proposed under the joint component model, because obviously we're talking about a combination of crisis, transitional housing, and rapid rehousing, permanent housing. And so the question of how much do you offer of each kind of housing should really be based on the need and what it is that individuals and families in your community are requesting. And depending, this is going to depend largely on, as well, on the available funding that the COC that you're working with is going to have. So they have a certain amount of funds to reallocate and or to assign to permanent housing bonus projects. So depending on what funding is available and the size and the scope of the proposal that's being made to create this joint component model, it might make sense to leverage other mainstream resources in order to be able to offer both kinds of housing projects and keep the costs of the proposal within a reasonable scope. So in other words, if you were to propose for funding to support transitional housing and you were able to partner with a mainstream rental housing provider who could support low-cost, rental housing for participants moving into permanent housing, that could be a way to reduce costs on the overall project and still ensure a sufficient amount of both transitional and permanent housing units to be available through the project. So partnerships with community partners is really encouraged, particularly between rapid rehousing providers and domestic violence programs. So I think HUD really understood that this is an opportunity, again, to create that bridge for participants who need to access both kinds of housing, and they really anticipated that this model might create partnerships between rapid rehousing and domestic violence programs to address that. But programs don't need to specialize, or who don't specialize in domestic violence, but who are serving survivors, should partner with domestic violence programs, but it's not required. So if there are mainstream homeless programs that are serving survivors, and they can speak to the need and offer appropriate housing for survivors through this model, then they would also be eligible. But obviously, it would be ideal if there were partnerships happening between their programs and local domestic violence programs as well. And having a comprehensive strategy that includes both domestic violence and homelessness is just going to support the justification for why a joint component model would be needed and would work well in a community in order to support the, and again, justify the need, the demand for this kind of housing and the gap that it fills in the community. So proposals for the joint component model should speak to how they're going to assess participants' needs and how they're going to prioritize participants in order to really demonstrate in the proposal that these projects are targeting the most vulnerable and again, really focusing on those who need to have, different options available to them and who will be able to move from crisis transitional housing into permanent housing. It should be able to, your proposal should be able to demonstrate the community need. If you have been working in your, with the COC's point in time count, then you would have a sense of what the need of survivors in your community is, what the demand for crisis housing might be. And so it's important to be able to speak to that in the proposal. You should also have outline program goals and outcomes that address safety and trauma-informed care for participants in these programs, that address the immediate housing need for unsheltered people, and address how to expedite people moving quickly into permanent housing. So again, it's really looking at the flow of folks who are coming into crisis transitional housing who have high needs or high barriers to getting into permanent housing and how they will be facilitated to move into permanent housing quickly. And then ultimately to speak to a strategy to evaluate the success of projects in improving system performance. So how will this model support what the overall system is attempting to accomplish in reducing homelessness for their community? The joint component model, given all of this, it has been suggested that, for communities that don't have emergency shelter or crisis housing for survivors, that they are good candidates for the joint component model. But that communities where stays in shelter or transitional housing are too long are not as favorable. And this really gets to HUD's priority to making sure that, that the crisis housing or transitional housing that's being offered is available to people who aren't being sheltered or who are in need of something short-term, but for whom permanent housing will ultimately be available to them. And so it's been suggested that, for example, in communities where stays in shelter or transitional housing are too long because there may not be adequate permanent housing or rapid rehousing options, that a better alternative for those communities would be to develop additional rapid rehousing rather than applying for a joint component model. So the questions that we think communities should be asking themselves when they're thinking about applying for this is how quickly will participants move into permanent housing? How long will they need to stay in the short-term shelter or transitional housing before they're able to be facilitated into permanent housing? How well will the project accommodate people with a variety of needs? Especially people who might have, who might be facing significant barriers to getting into permanent housing. How well will the project connect people to valuable community resources? Are those resources available, and will people be able to take advantage of those? And then does the project fill a gap in the community's response in looking, again, at the overall systemic response to helping end homelessness in the community? So finally, just a few points that because the focus of this project is on crisis housing for unsheltered people, and the intent of the project is to move people quickly from short-term housing to permanent housing, the emphasis is on communities where there really is not enough short-term housing, and again, not on communities where there's not enough long-term housing. That's what would be considered an ideal context for a joint component model project. For communities that have lost transitional housing, again, in the past, it's important to be able to demonstrate the number of survivors who aren't connecting to permanent housing. So again, it is possible for programs that were defunded to apply under this model if they're able to offer both transitional and rapid rehousing or permanent housing. But it'll be really important to speak to the number of survivors who aren't connecting to permanent housing or who aren't being sheltered. And then finally, that it'll be helpful to address the way in which programs enable participants to move on to permanent housing quickly and according to their ability and choice. So we're hopeful that that the number of programs will find this model a good opportunity in partnership with their COCs in order to create more housing for survivors. And I think with that, yes, we are moving back to Debbie to wrap it up.
Thanks, Peg and Christy and Britt, for all of your in-depth information. I'm going to wrap it up on outcomes and comparable databases, and I just want to thank everybody for your engagement in the chat box and continue asking questions as we wrap up the last portion of our webinar. So as I said in the beginning, I'm Debbie Fox. I'm the Senior Housing Policy and Practice Specialist of the National Network to End Domestic Violence. So NNEDV we're the leading voice for domestic violence victims and their advocates, and we're a membership organization of all the state domestic violence coalitions. And we work closely with our members around policy issues and different issues that arise and coming up with innovative ways to lead the field and addressing intimate partner violence and domestic violence. So I did send out a link for those on the call for local domestic and sexual violence programs. I did send out a link in the chat box of how you can reach out to your state domestic violence coalitions. If you're not connected to them, I encourage you to connect with them. And many of them are working on these issues as well at the state level, so they can provide support in addition to the support of the Housing Consortium. So I'm going to go a little bit more in-depth in terms of systems performance and what's required in the HUD NOFA for fiscal year 17. So folks know and just can be aware, it's around pages 49 to 51 where they talk about system performance measures. So for those involved with their COCs, you all know, and as Christy mentioned, that there's a finite number of points. There's 200 points for the NOFA, and every point counts. And so a big part of the NOFA is the system performance measures. And so that portion of the application is up to 49 points that are granted in the application. So it's very critical when COCs are applying. They're really looking at the system-wide performance measures. So not only is it what's happening in an individual program, but they're looking overall how the community is responding to ending homelessness at the system level. And then, of course, then at the project level, that's very important. So that's how, as Christy was mentioning, that's how different programs are tiered or ranked by their project level and how that wraps up into the system. So there's many different organizations and agencies doing different things, and they're working together toward a common goal of ending homelessness in their communities. So let me move the slide as well. A big part of the system performance measures, and there's 7 measures that are accounted for. That there's 7 measures that are really important in terms of the NOFA application. And if you're working with your COC, this is what's talked about, and this is what is the data points that are being collected when people are when they're going through the system. So the overall community, the overall system is looking at reducing the number of homeless individuals and families. They're looking at reducing the number of first-time homeless. They're wanting to shrink the length of time homeless. So when people are looking at like we're talking about rapid rehousing, getting people into the system, out of the system quickly, we want people to be homeless for the shortest amount of time possible. We're looking at successful housing placement and retention. And we want fewer returns to homelessness, and then there is an outcome on maintaining or increasing income or having job growth, and then there is also HMIS performance measures in terms of like your data and your data quality is of high quality and that the information is captured. So as I mentioned, HUD does award 49 points for this related to reducing homelessness. So it's a really critical part of the competitive process for getting homeless funds in the local community. So how systems look and compare their data and how successful they're doing in ending homelessness, they look at the data compared from the fiscal year before to the fiscal year, so it would be fiscal year 2016 to fiscal year 2015. So you're measured as a whole entire system. So how you're doing as a system is how it's ranked, and that's how then it's awarded at the federal level. So there is use with the domestic violence providers in the comparable database. There's use of aggregate data and other data to support performance. This is really critical and a very hot topic conversation that we could do. I think I'm seeing from the chat room that this is I think a webinar in and of itself around comparable databases. I'm seeing a lot of people talking about that in the chat room. So basically, there's the HMIS database where the homeless system that's the data where they enter their data. The database is where they share their information, and it's much more open in terms of like the flow, more people are being seen throughout the system, and the information is not confidential in the HMIS system unless someone requests that they be entered anonymously or confidential, and they're still able to access services within the homeless system. But the homeless management information system, the databases that the homeless providers are using are much more open. And as DV providers, we know comparable databases are a way that we have our information remain confidential, so we can be in compliance with federal funders with FIPSA and VAWA, which have very strict requirements around confidentiality and not sharing personally identified information about DV survivors, because we know the safety and issues that are impacting the population that we work with. So it is really important for us as a field and domestic violence providers to be aware that comparable databases are something that we need to be looking at and using as HUD has moved forward with new SAGE requirements. So a lot of providers are still using paper pencil, but now there's a requirement that we enter data. It has shifted from eSNAPs into a reporting platform called SAGE, where you have to enter data through and upload it through the CVS, so it's going directly from the database into the reporting platform SAGE. So it's really important that DV providers are informed and that you all know that this is coming down the way, and we have sent out an email document that talks about the SAGE requirements. So it's really important that you all know about it and that you are getting up to speed in terms of thinking about databases to purchase and what may work for you. And HUD has offered a grace period for those providers who are still working out the kinks in terms of trying to get your information onto a comparable database. So we are here at the DV Housing Consortium. We are here as technical assistance support to help you with those issues. And then I also sent out a link that NNADV put out a year or two ago that basically highlights choosing a database, and there's different databases that are highlighted there. And we're always wanting to learn more about databases because providers across the country are using different ones. So if there's ones that are working well for you, we definitely want to know about it. And yeah, so that's about 10 minutes of information, what would easily be an hour or more around comparable databases. And so in terms of performance and strategic planning, so these are the overall performance, what is evaluated in the community. So again, there's quite a number of points, 60 points that are part of the overall 200 points of the HUD NOFA. So overall, when your communities are doing different initiatives or working to end chronic homelessness or working to end homelessness among families or households with children or youth homelessness or veterans homelessness, that's directly linked to the HUD NOFA. And there's real opportunities for DV programs to connect and bolster and work with the COC programs to increase the performance measures and to help your local COCs get to the points that they need, because as Christy mentioned, every point counts to help them get to the maximum amount awarded, so funds and resources can come to your local communities and your balance of state to help end homelessness in your areas. So this is also the link to the COC program competition here, so you can click on that there. And I want to direct you again and just remind you that a lot of the resources for the Safe Housing Partnerships are for the NOFA are on this website. There's also a page where you can connect to the DV Housing Consortium. There's a box where you can fill out your information and email us. You can also email us directly through the slides. We'll be emailing the slides out after the webinar, so you can email the presenters and myself if you have specific questions you really want to work through. And I think at this point we have covered a lot of dense information and a lot of very detailed information and contains about 65 pages of the HUD NOFA into about an hour and a half of information. So hopefully we've helped you all and covered some broad strokes around the HUD NOFA process and helped give you some tools and resources that will help you move you through the process. At this point, we're going to take questions through the chat. There's quite a number of people on the call, so we're not going to open up the call, but we're happy to take questions via the chat if there's specific questions in the last 8 minutes that we have. And I'm going to open it up to the rest of my presenters as well if there's anything else that they want to add before we wrap up. So any last questions? Yes, we can get a copy of this training. Yes, that will be sent out. We have a list of everyone's emails that registered, so we'll be sending that out along with the recording of the webinar so you can share it with colleagues as well.
So, Debbie, this is Christy. The other thing I would say is, just to echo what you said, we covered a lot. It was fast and furious, and I know for some folks it probably felt like we glossed over a lot of things. So if you have a question or need further clarification, if I can get that out, please email us, and you can do that through the Safe Housing Partnerships website, and we will be happy to provide any additional context and follow-up answers that you might need.
There's been a lot of questions around the cost of comparable databases and how people are covering the cost of those. So there's a lot of different ways that that DV providers have covered the cost of those. So it can be part, even though it's a comparable database, it can be part of the budget item in the HMIS budget that you would need to work with your COC around those issues. But DV providers have also funded the cost of their databases, the comparable databases, through state funding, county funding, local funding. So there's a number of ways that people have covered the cost of those, and it's really important to keep in mind as you purchase a database that you will need ongoing maintenance and support and ongoing costs related to keeping licensings going or keeping it going year after year. So make sure to think about that as you're planning your budget out and applying for these or reapplying for these funds. I see a question about an August 2nd webinar. I'm pretty sure that's the National Alliance Against Homelessness webinar on the HUD NOFA. If you go to the National Alliance website, just Google National Alliance to End Homelessness, you can go to their events page and you can register for their webinar on this topic as well. So if you...
the Alliance webinar will be August 3rd. USICH's webinar will be August 2nd, Wednesday at 2 p.m. So USICH will do a webinar on the entire NOFA. I think the Alliance is digging in on the joint component project for their webinar on Thursday. So you can fill your week with webinars, but endhomelessness.org is the National Alliance, and usich.gov is USICH's website, and you can find more information there.
Thank you, Britt. We will send out the comparable databases and HMIS document that we're finalizing, should hopefully be out in the next week. So that's on the home stretch. I see someone asking about that. Any other last minute questions? All right, I'm going to go ahead and wrap it up. You're welcome to contact us through the Safe Housing Partnerships website, through the technical assistance request box there. And if you have any other questions, please reach out to us, and we'll send out the webinar recording and the slides shortly. So thank you all.